treatment just a couple weeks after, so I feel like I've kind of followed her journey throughout this time, and she's had ups and downs, and the universe just keeps throwing things at her, and she keeps fatting it back out, and she's done it with just amazing grace. So I'd like to introduce Miss Kimberley Griffin Burns.
Good afternoon. I'm honored to be here today and find it a privilege to share my story with you. It is complex and I'll do my best to keep it short. I am every woman in this room. I am a daughter, a sister, an aunt, a mother, a wife, a very proud grandmother, and a friend. I'd like to tell you a little bit about myself before cancer. I'm a dancer, a big theater buff, and an artist. I taught the GED at Western Piedmont Community College in Morganton, North Carolina. I was an avid hiker, rock climber, worked music festivals, volunteered for Warren Haynes' Christmas Jam for Habitat for Humanity every year, and I led a very proactive life. I have an adventurous soul with a great awareness for fairness and an unwavering faith. My story begins in 2012 at age 42. I married the love of my life, Scott Burns, on May 5th, the 2012 supermoon. 2 months later, while doing my self-examination, I found a large lump in my left breast. I had not had a mammogram yet, so I called the imaging center hoping to get an appointment, and they informed me I had to have a doctor's order for a mammogram. This was difficult for me. I had no primary physician and no insurance. I tried to find a doctor but was unsuccessful. My husband told his primary care physician of my plight, Dr. John Davis, and he agreed to see me. The next week he examined me, felt the lump, and sent me for a diagnostic mammogram that afternoon. The next day, his office called with an appointment to see a surgeon, Dr. Paul Dagger, at Watauga Surgical. Dr. Dagger's office worked quickly. They called me the next morning to let me know that it would be $300 for the consult, and any other added charges for procedures were done to be paid by me at the time of service. My appointment was at 3 that afternoon, and I nearly panicked, because I didn't have the $300 or any other money for procedures. Then I remember seeing a program for women to pay for mammograms. I went online to .gov and found the BSEP program, Breast and Cervical Cancer Treatment Program, based at Watauga Health Department. I called and was connected to the program director, Faith Hayworth. She had me come in at once. She began the paperwork for breast cancer Medicaid, and I had my appointment paid for by the Susan G. Komen Foundation, so I made Dr. Dagger's appointment that afternoon. Dr. Dagger did an ultrasound-guided biopsy on the left breast and ordered a stereotactic biopsy on the right breast. These were both painful procedures, and I personally feel and wish that I had received some sort of sedation because it was somewhat of a traumatic experience. They found pleomorphic growths at the chest wall of the right breast. They removed as many as possible and placed markers. The biopsy on the left breast came back inconclusive, but Dr. Dagger was convinced it was cancer, so he did another deeper ultrasound biopsy. It came back cancerous. It was the end of August, and Dr. Dagger told me I needed a bilateral mastectomy. We scheduled the surgery for September. In the meantime, I met with the plastic surgeon, Dr. Damon and Agnes, who explained the different options I had for reconstruction. I decided to have expanders placed during my mastectomy surgery. I met with Dr. Yvonne Mack about radiation on the left breast and Dr. Anna Sobel, medical oncologist, about my chemotherapy. The plan was a skin-sparing mastectomy on the left with expander placement with no lymph node involvement, and a prophylactic mastectomy on the right, expander placed at the time of my surgery. In September, I underwent my mastectomy. When I woke after surgery, I had no expander on the left, meaning I had lymph node involvement, which meant chemo and radiation. I was afraid for the first time. I went through a huge change after my mastectomy. I felt like an amputee losing part of my body. It took weeks before I could look at myself in the mirror. My husband Scott was wonderful during this time, telling me I was beautiful and strong. They began counseling at CBB Jones, so I called Melanie, the chaplain, and began seeing her. It was empowering and encouraging. I later found a regular therapist that I see to this day. Without Melanie and Dr. Mikey Gordon's guidance, I believe I would have been lost at that time trying to deal with all my changes alone. I began chemo in October of 2012, weekly trips to CB for treatments. I lost my hair and went into medical menopause. This changed my body even more. My skin changed, I had mood swings and terrible hot flashes. I had chemo on my birthday and they gave me a cupcake. Most days I felt like a truck had hit me, but I kept moving forward. I completed my treatments without much complaints in January of 2013. My radiation started a month later in the middle of February. I had 30 courses, every day for 30 days except for weekends. It was short and painless until it began to burn. Dr. Mack kept a close eye on my burn and proceeded with radiation. The last 5 treatments focused on the mastectomy scar alone. By middle March, my treatments were over. I healed and began to merge back into society and my community, feeling more at ease with myself. My treatments were completed except for medical oncology. I was put on tamoxifen for 5 years, and my visits to the cancer center were every 3 months to see Dr. Sobel. When it came time to complete my reconstruction, my insurance denied it, claiming a coding error and not having prior approval for the original surgery. I called Angie Shoemake, CB social worker. She was eager to help. She spent days on the phone with me trying to remedy my issue. One afternoon, Dr. Anagnos called and said he had found where my insurance had paid for the first surgery. I went immediately to his office, picked up the receipt, and went straight to see Angie. She called the insurance and explained she had payment for the procedure in her hand and they could not deny my reconstruction. She faxed the receipt to them, and the next morning I had approval. I had tram flap reconstruction on the left breast and an implant placed on the right breast, July of 2013. Everything seemed normal after my surgery and I was happy, until 1 month later I developed an infection in my abdominal incision and had necrosis on my left breast. I had 29 months of wound care. During this time, I moved on with my life, taking tamoxifen and seeing Dr. Sobel every 3 months. I learned to live with axillary cording syndrome, truncal and left arm lymphedema, peritonitis of the abdomen, and general daily fatigue. 3 years passed with no known cancer. I continued with tamoxifen until I had a hysterectomy in 2015. Dr. Sobel changed my oral med to anastrozole because of being in complete menopause. Unfortunately, I had a reaction, angioedema, swelling of the tongue and face, and Dr. Sobel had to place me back on tamoxifen. In January 2016, one morning while getting ready to teach a belly dancing class and on the phone with my mother, I felt pain shoot up my spine and out the top of my head. I began projectile vomiting and thought I had developed a migraine. I went on daily for 3 weeks with the migraine and vomiting until one night, trying to walk to the bathroom, the pain hit again and I hit the floor. I have to go to the emergency room in the morning, I told Scott. The next morning I was at Cannon in the ER having a CAT scan. The doctor came in and sat on the bed and asked if I had an oncologist. My heart sank. He explained they had found a tumor in my spine and it had destroyed my T5 vertebra. That afternoon I was back in Dr. Mack's office. She ordered numerous scans and a biopsy of my spine. After the scans, she told me I'd be having a biopsy of the abdomen. I was confused on how they would determine my cancer from an abdominal biopsy, but decided they knew the best course of action for moving forward. The biopsy was near painless, and I was grateful for this, I assure you. I had 15 courses of radiation on the spinal tumor and went to Dr. Sobel to discuss my best course of action with chemotherapy. On February 26, 2016, my husband Scott, my daughter Candace, and my mother Sharon went with me to hear my prognosis. We all sat down and Dr. Sobel began to explain that I had an incurable cancer of the brain, thoracic spine, and omentum. The omentum is part of the peritoneum of the abdomen. She told us then I had 3 to 6 months to live. As you can imagine, tears and sobs filled the exam room. This is the place to cry, Dr. Sobel assured us all. I asked her what we could do, and she said chemo for the rest of my life. This was all hard to hear and process. I left feeling numb. I sat around for 3 weeks feeling sorry for myself, then one morning while in bed, a voice thundered through my head, "Get up, put your feet on the ground and live." That's what I did, and that's what I have done since. My faith pushed me to move and be involved. I pushed through neuropathy in my hands and feet and stay busy. I don't climb mountains any longer, but I paint, sculpt, play guitar, and I started writing a book about my life. I've tried alternative treatments like the promising treatment of immunotherapy. Unfortunately, it did not work for me. My tumors grew, and last October 26th, I was hospitalized with a bowel obstruction. A tumor had grown around my small intestine and squeezed it off. I thought then I was a goner. After surgery to remove the tumor and straighten the bowel, I was sent home for 10 days to heal. I slept for 10 days, healing and getting used to the gastric tube that had placed during surgery. I had the gastric tube for 6 to 8 weeks. I thought I was a patient person until having a tube hanging from my stomach that had to be flushed daily. My skin became irritated at the incision, my activities were limited, and I was waiting to begin chemo again. I worked on my book to keep me occupied and participated in CB's activities like the Radiance program, painting, fly fishing, and other activities. I would urge you to use your Cancer Center resources and activities. Get to know the nurse navigator, social worker, counselors, chaplain, etc., and be proactive about your health. When people ask how I would describe who I am, I like to think of my description as King Sisyphus. He was a Greek king who kept cheating death, and it so angered the Greek gods they sentenced him to an eternity of pushing a rock up a hill just to have it roll back down. Albert Camus, a French author, theorized that Sisyphus found his purpose in pushing the rock every day. I have found we all push rocks. Mine is cancer. I pushed this rock, and in doing so, I have found my purpose. I share my story and hope with others. Not to be afraid of your diagnosis or prognosis. Your future is in your hands, and we can fight this terrible disease by keeping faith. Wedge your shoulder in and push your rock. Thank you.